For women who are on extended courses of chemotherapy for 5 years or so, what are some of the biggest reasons you hear for drop-off in terms of their adherence to their medication?
So I think you have to divide the treatments, for instance, chemotherapy, cytotoxic therapies, endocrine therapies, such as hormonal drugs, such as tamoxifen or aromatase inhibitors, are more falling into the category of endocrine therapies. And adherence is usually an issue for those drugs that are orally given. There's only one oral chemotherapy that we have, but it's mostly for the endocrine therapies. So the question number one becomes, in what situation you take those agents? Do you take them for prevention? So there's now approval for tamoxifen, for aromatase inhibitors, to use them purely for prevention. So for women who have no cancer history, who don't have cancer, but are either over the age of 60 or have breast biopsies that show that they will be at higher risk for breast cancer development in 5 years or so. So those biopsy results could be ADH, atypical ductal hyperplasia, or LCIS, all of which increase your risk of breast cancer over your lifetime. So in those preventative settings, the agreement to actually use prevention medicines is relatively low, among women. And even women who start treatment have often a dropout. Again, this is for prevention. So this is a very individual choice where you say pros and cons of the drug. What is the risk reduction for you personally? And then are you willing to do this? The other scenario is are women where you give those medicines to prevent recurrences of breast cancer. So that's called the adjuvant setting. And in that scenario, we know that the outcome is better if patients adhere to the treatments. Also, prevention is definitely more effective if you take the medicine. So in those two categories, we see that that adherence is not very good, not 100%. Studies show maybe 50, 75%. And the question is why? Is it because of side effect profiles of those drugs? So aromatase inhibitors are known to cause joint aches, body aches, pains, hair thinning, feeling older on those medicines. So talking about those, weighing benefits and risks with each woman is very important. Tamoxifen, for instance, can cause decrease in libido. It can cause weight gain in women. It can cause mood changes, depression. So that needs to be discovered or at least figured out, because if you have those side effects, there are ways to circumvent them. There are other approaches, medication or even talk therapy or acupuncture, to circumvent those side effects. But you really have to figure this out with your oncologist to increase the chances that women adhere.
Great. Well, thank you so much for
My
talking
pleasure.
with me today. This was very informative.
Good, thank you.